Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as the social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders from the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.faaai.org. Today's edition of our Conversations from the World of Allergy podcast series is targeted towards Academy members and any healthcare professional interested in learning more about how artificial intelligence is and will be impacting healthcare. I suppose it's really relevant for anybody listening, patients as well, and the general public. Today's guest is Dr. Nick Ryder. Dr. Ryder is a professor in the Department of Health Systems and Implementation Science at the Virginia Tech Carilion School of Medicine, where he serves as an Associate Chief Medical Information Officer focused on research data operations at the Carilion Clinic in Roanoke, Virginia. Dr. Ryder has led a fascinating career as an allergist immunologist interested in complex immunopathologic disorders and in utilizing clinical data science approaches for optimizing patient care. We're going to dissect all of this as we get into it. But with that, Dr. Ryder, thanks so much for taking the time to join us, and welcome back to the podcast.
Thanks, Dr. Stukas. Great to be with you, and please call me Nick.
All right, Nick, sounds good. Well, you've been on the show before. Last time we had you as a guest, it was way back in episode 60 when you discussed primary immune deficiency, which I know is a great passion of yours. And it seems like some things have changed for you in your career since we recorded that in 2021. Do you mind giving us an update about your current position and maybe what precipitated the move for you?
No, not at all. Not at all. Really what led me into the field of allergy immunology was this passion for caring for patients with primary immune disorders. And honestly, I always thought I would do kind of wet bench translational work. And then maybe about 7-8 years ago, when I was at Texas Children's, we were thinking about ways that we could leverage the health information technology system to improve diagnostic rates for patients. And that's led me along a very unexpected, circuitous, I would say, route where I've become board certified in clinical informatics as well as allergy immunology, and I've spent a lot of time thinking about how we can optimize the health system for patients and clinicians. And ultimately, that's taken a bigger part of my practice and my roles. And so when I had an opportunity to move back closer to family in Southwest Virginia, I was very excited about that. And after a short stint at another institution, I learned of Virginia Tech's program and the embedded Department of Health Systems and Implementation Science within the medical school. And this really tight collaboration and link between the School of Medicine, the research enterprise at Virginia Tech, the clinical enterprise at Carilion Clinic, and then this department, or HSIS, or Health System and Implementation Science, that really systematically studies how healthcare is delivered and how it can be optimized iteratively moving forward, really in this context of a learning health system. And that's become a passion of mine, is how do we get to a true learning health system? And so this role coupled a few of the things I was really excited about. First and foremost, taking care of patients with primary immune disorders. Second, research and operational foci in clinical data science and clinical informatics. And then I do have a passion for rural care, growing up in northern Pennsylvania along the Appalachian Mountains. So it was kind of a combination of all these elements that led me to this role.
That's fantastic, and congratulations. It sounds like an amazing
Thanks.
opportunity. It's always great when
Thank
the
you.
location and the opportunity sort of match up. So are you still seeing patients with primary immune disorders or allergic conditions, and what does your time split kind of look like if you are?
I am. I have clinic half day a week. So, but I try and really, thankfully, I have 4 great colleagues who do the full spectrum of allergy immunology, and I'm happy to see anyone, but they are excited about having someone who focuses on clinical immunology and more, recurrent infection evaluations, pathological inflammation evaluations, immune dysregulation evaluations, which is something that I've grown my skills over time as a clinician. And so I've been able to really, over the past few months, and I've only been in this role for 6 months now, but over the past few months since starting clinic, to start to grow a fairly substantial cohort of patients that either were traveling quite a long distance to get to an expert clinical immunologist or didn't have one. So that's also been very gratifying to open up access for folks that didn't have it or that were encumbered by the access that they had.
That's
And so
excellent. And
that's 10% of my time to follow up. Sorry. I
oh
spend
no,
about
yeah,
70% of my time in research, have a clinical data science lab, PhD students in the lab that I'm fortunate to mentor, and thankfully also a number of medical students in our region that come to work with me, and some great collaborations. And then lastly, the operational leadership role as an associate chief medical information officer. Excuse me.
yeah. So as always in your career, you have your sort of hand in many different rings and contributing at a very high level. I chuckled on the inside when you said your colleagues are excited to have you 1/2 day a week to see those very complex immunology patients. I have no doubt that every allergist listening to this episode would be excited to have you for 1/2 day a week in their clinic as well. So that's
Oh,
great.
it's kind of you. Thank you. Yeah, I try to be a value add. I mean, I joined a terrific team, so you always you want to, with humility, add value and not be too much of a disruptor. Although I've been told that I'm lovingly disruptive, so we'll go with that.
I would agree with that. We had Dr. Penise Corey as a guest 2 years ago, 2022, and she discussed the similar topic of artificial intelligence. That was in episode 72. And we'll put links to this in your prior episode for all of our listeners on the landing page. It seemed like 2 years ago, we were really just in the beginning stages of how artificial intelligence could impact medical care. Is it fair to say that things have advanced since then? And if so, what do you think has been the greatest evolution thus far? We're going to talk more about the various ways. But if you had to pick out what's been the greatest evolution in the last couple of years, what do you think that is?
Yeah, I think there's just been increased awareness, especially with the launch of ChatGPT in November of 2022. I think that has generated a lot of excitement. It's also allowed for maybe a little bit more tangible access to pretty potent AI to the general public. And then certainly there was interest in machine learning at that time, and Penny is terrific, and certainly I'm sure brought tremendous value at that time, and continues to, of course, but probably talked a lot about that and the machine learning aspect. And I think we're seeing that beyond some of those initial use cases like diagnosis or preventing adverse events, we're seeing that in the advent of the large language models and seeing electronic health record companies bring that technology into their platform and suite of functional, offerings. That suddenly the use cases, and by use case I mean the particular task that AI and machine learning may be applied to, has really exploded exponentially.
You've already, mentioned some of these hot terms and things like that. So I think maybe we can just have you start by giving us some basic definitions so that all of our listeners have a good starting point. And if it's okay, let's just go ahead and start with how would we should all define artificial intelligence, and how does that differ from augmented intelligence? We talked a lot about that with Dr. Corey a couple of years ago.
Yeah, no, great question. So artificial intelligence AI, I would describe as a pretty broad term, and any mechanism or any tool that is used to mimic human intelligence. And so that can be a very simple rules based classifier or rules based tool, to large language models and some of these neural networks that people talk a lot about. And I think the difference would be from augmented intelligence is that with AI, with artificial intelligence, we're really thinking about mimicking human intelligence and the way humans
Mm.
reason, whereas augmented intelligence is applying AI to facilitate and help human decision making. So I think that speaks to more of the partnership between the technology and the human.
Okay. And you mentioned this term just a few minutes ago. What is meant by the term machine learning models?
Yeah. So machine learning would be a subdomain of artificial intelligence. And in this case, we are talking about models that improve over time with iterative training. And so that we would by whatever means we're assessing performance of the model, we can continue to see improvements or expect to see improvements in that prediction task, if you will, over time with repeated and updated training. So I think that is really the difference between machine learning and AI, and that machine learning is a subdomain where these models improve performance over time with repeated
Yeah.
training and learning.
Okay, and this is kind of like when we read about AI getting smarter over time and then eventually taking over the world. It's because of the machine learning going on.
Yes, exactly. Hopefully not
Okay.
taking over the world, but certainly getting better at doing what it's supposed to be doing.
Yeah. Well, we all know that's already too late, but that's fine.
We'll get to that later, maybe.
Yeah, yeah, perhaps. I keep thinking about the Terminator, but all right. Okay, so
Right.
and you mentioned Chat GPT, which I think everybody's familiar with, and you also used the term already, a large language model. So, what are large language models, and how are they most often utilized?
Yeah, LLMs or large language models have really exploded on the scene. I mean, this technology has been around for quite a long time, several decades, in fact. But I think today's LLMs, including ChatGPT, are they're large, complicated models that effectively perform, though, at the end of the day, an ability to predict the next word, if you will, in a sentence. That's what they do well. So if you give a model, a sentence with a word missing, like, and I'm going to quote Nigam Shah, who's really a pioneer in this space and clinical AI in general. And he was asked about this, and I liked his response, so I've adopted it. But I'm giving Dr. Shah credit for that, and that is,
Mhm.
if you say, "Where are we going?" or "Where are we at?" and you only give the model "Where are we?" and the model has only been trained to recognize those two sentences. What's the probability that the last word will be going? And the probability in this scenario is 50%. So LLMs do that at massive scale, and they can predict the next word in the sentence. They can predict the next paragraph or series of paragraphs when prompted very simply. And certainly they've improved over time from even what we saw with the initial offering of ChatGPT. And I think the other thing that's really exciting about these models is they don't only predict the next word, but they can be used to predict numerical values and protein sequences,
Mm.
DNA sequences, and so forth. So it's really the fact that they can effectively learn from a massive amount of information because of their internal complexity, the next item in a sequence that has some repetitive nature to it.
That's one of the best explanations I've ever heard. And I know you paraphrased and quoted Dr. Shaw, but that makes a lot of sense. So, to help me better understand, and perhaps some of our listeners as well, the like Google search bar, it seems to me like that was one of the early iterations of an LLM where you type in "why is my," and then you get like some of the most common next words that come from that from other people using the search bar. Is that a correct assessment, or am I way off base with that?
Yeah, no, absolutely. And I mean, this level of sophistication is under the hood of everything from search engines to Google Maps, and
Mm.
predicting routes, and some of the downstream, 100 miles from now there's a light that's red now, and suddenly changes the time by 1 minute to your destination. So absolutely, this technology has been evolving and has been part of technology that we use, or interfaces that we use on a regular basis, on a daily basis. And it's just really become more evident with the release of ChatGPT in November of 2022.
Wow. Well, let's kind of pivot and focus on some ways in which artificial intelligence is already being used in healthcare, as well as maybe some potential applications for the future. How can AI-powered tools and technologies help improve patient diagnosis, treatment planning, and outcomes?
Yeah, I mean, I think that's a great question. I think that those are some of the first line important um, foci and use cases for AI. I think first and foremost, they have to be trained effectively. I think the technology is there to be able to predict that a patient has a particular disease from amongst a general population. And that's been a big focus of our work, especially in the rare disease space, where many of these patients come to medical attention quite late. We want to compress the diagnostic odyssey. So the technology is there. So I think the first challenge is really getting good data to train these patients, to train these models to improve outcomes. But I think let's assume we have that solved. Then I think deploying these models, in electronic health record systems, maybe through wearable devices, maybe even through web-based and deployable tools to facilitate even patient insight about what their health condition might be, are all opportunities that we're still advancing. And I think hopefully in time, and I think we're starting to see some light at the end of the tunnel around this, we'll see true personalized medicine because of the use of AI and machine learning. So I don't know if does that help address the question, or certainly you know help me refine my answer if you feel like you wanted something
No,
else there.
no, I think that's good. It's what you made me think of just now was, I think you and I are approximately the same age, but I was in medical school 25 years ago, and I distinctly remember being told that IBM Watson was going to make us obsolete as physicians. Because you can plug in, symptom checkers, and it tell you this is the most likely diagnosis. And yet here I am as a physician 25 years later. So I guess that leads to the next question of, like, is this going to be more augmented, or are we going to approach the time where people can really just reliably put their symptoms in online and get a good diagnosis and treatment?
I mean, I think we are in a place where these large language models can provide, and to varying degrees depending on which model you use, some pretty good insight about a person's underlying medical condition, and maybe even what the next step should be to should be taken to evaluate that or to verify that. So I think we're pretty close to that. That being said, I I think we're going to be in the augmented intelligence phase for quite a long time, for a variety of reasons, and certainly because I'm not sure the public trust in AI is there yet, and I think that's a reasonable thing. I think also because healthcare is by nature a pretty conservative industry, and so I don't know that outside of really well guarded models, at least within the clinical environment, within the electronic health records, I don't think we're going to allow these models to just kind of run hog wild, if you will, and be
Hmm.
unconstrained without some significant oversight. And again, I think that's very appropriate also.
Hmm. Yeah, I think those are excellent points. Well, how can artificial intelligence be leveraged to make healthcare more accessible and equitable? Those are obviously, very hot topics, as they should be over the last few years, especially for the underserved populations.
Yeah, this is a big issue. It's a great question, a super important topic. I think we're probably scratching the surface of around disparities and understanding disparities, and certainly we do understand many of the factors of disparity, both in rural and urban settings. But my hope would be that AI, first and foremost, would be effective for all members of a population. So I think that's one of the things that we need to do out of the gate, is to make sure that the models are not biased in such a way that they perform better on one population than another. And typically the way that happens is that marginalized people groups, or folks that may not have the access that they should to healthcare, don't have data in the system to even train on. So it wouldn't then be surprising that the model wouldn't perform well on members of that people group. So I think first and foremost, we have to really guard against some of the disparities that already exist and then amplifying them with AI. So I think that's the first kind of do no harm. I think how do we actually improve healthcare with AI, which is really, I think, it's more to your question, and it's a terrific question. And hopefully AI can facilitate access, perhaps make us more nimble in our ability to interact with patients by extending us in ways that we feel good about through chatbots and things like this. Perhaps wearables. I do think wearables and AI embedded wearables will improve healthcare processes and outcomes for patients by getting insight and physiologic data as patients would deem appropriate to share, that will inform treatment pathways, uh, therapies, interventions more promptly, and so forth and so on. So I think we can imagine so many different exciting possibilities for using AI, machine learning to improve outcomes and detection of risk events, and maybe even reduction of need for medications and being kind of more nimble in all of those ways.
I think most people are probably familiar with wearables. I mean, we've been wearing Fitbits and fitness trackers for years. What's an embedded wearable? What do you mean by that?
Oh, I'm sorry, I meant a wearable with AI embedded. So a lot of the
Ah,
wearables now, they'll collect data, but they don't necessarily provide any information back to you or recommendation necessarily. Some do, but I think we're going to see more aggregation of this kind of data and then AI applied to the data that's collected through wearables to provide guidance to patients
okay,
and
gotcha.
hopefully healthcare providers too.
Oh yeah, right, right. Well, what skills and knowledge do healthcare providers, professionals need to effectively work alongside AI systems in their practice? That's a great segue to this.
Yeah, no, great question. I mean, I think this is such an interesting time because, like you, yeah, I was in med school, 20 plus years ago, and we didn't even use electronic health records then, right? Everything was written.
Mm-hmm.
Everything was handwritten, which when I look at my own handwriting, that's an upside of using an electronic health record. But now we're inserted into this environment where technology in a very disruptive way is transforming the practice of healthcare, and so there is this need to understand technology at a certain level, even if one says, "Hey, I don't want to become a clinical informatician or a clinical data scientist or an AI developer." Yeah, I think we all really need to understand how the models perform, and that is, within which context is the prediction accurate? What are the caveats to that? For this patient, is this model the appropriate one for this particular task or this particular prediction task? Is this the appropriate model? So I think we have to be pretty well informed about what kind of data the model has been trained on, how that relates to the data that it's being fed now, and then how its prediction relates to the individual patient that we're caring for right now. And I think that seems like a lot, but I do think that in time and hopefully also in lockstep with the electronic health record functionalities that are becoming available, there's going to be good tools, both in the form of people and clinical informaticians that are in your healthcare environments, and also just information that you have. You don't have to read a large document, but they can help give you information and feedback like, hey, the model predicts this, but here's some caveats in this particular situation. So I think we need to bake in some of these guardrails and some of these alerts that qualify the quality. But I think this is also why clinical informatics has become a specialty, because healthcare and medicine is so complicated that just like I can no longer keep up with all of general internal medicine and general pediatrics, and I think it's hard enough to keep up with allergy immunology. Then you add on clinical informatics. We need specialists in that area that can help support us to make sure that we're getting the most out of these tools, that they're not doing harm and that are actually improving care. So I think those are some of the high level ways that we can be informed, and that is really interacting with our local informatics teams and health IT teams. But I think this is going to become a part of medical education. I mean, it already is becoming a part of medical
Mm-hmm.
education at the earliest levels.
Oh, I guess that leads to the next question, which you've sort of touched upon, but what are the biggest roadblocks or challenges to wider adoption of artificial intelligence in the medical field right now?
Yeah, I think it's still institution dependent in terms of their culture. I think there's
Mm-hmm.
the kind of the global challenges and then there's the local challenges. The global challenges would relate to just making sure that we balance and understand the benefits and the risks of AI, and making sure that things like trust, that we can trust again the model's predictions, governance, making sure that we understand how these are regulated, privacy and security of the data, bias and fairness, all of these really important elements are addressed. And I think that's globally uh, not a slam dunk, and no one has completely figured that out, although there are certainly large organizations that are working on that and providing good guidance. But I think that's a global barrier. It's just making sure that you're using these tools effectively and not doing harm in doing so. I think locally, every healthcare institution, and I'm sure you would agree, be interested in your thought, has their own culture, right? So some are,
Hmm.
I think in general, healthcare is conservative for appropriate reasons, but some institutions are a little bit more willing to take on disruptive technologies and embed them, even in the background, just to kind of test them and fail fast, so to speak, before they're deployed. Others aren't necessarily sure how to use them. So I think we've got a little bit of both the global and the local challenges to overcome to widely adopt AI. But I think it's happening. I mean, certainly I'm seeing it in my institution. I'm sure you are. And we're seeing this kind of progress of acceptance, and then how can this be implemented, and how can it be sustained in a way where we like, hey, it's doing. We tested and verified that this machine learning model is performing well at time zero when we implement it, and that it's making the appropriate predictions, and we're validating that through, again, augmented, shared evaluation of its predictions. But 6 months from now, 12 months from now, 18 months from now, we have to sustain it. So I think this trust will grow, and our ability to embed AI and machine learning in clinical workflows will also grow, and we'll I think that will facilitate and spin the flywheel a little bit faster with each kind of epoch of this, globally and locally.
I couldn't agree more regarding the wide variability in different institutions and their adoption of new technology or things like that. So, personally speaking, my area of interest has been social media for over a decade now. And to be frank with you, my institution adopted social media early on, and they've been very prolific on their own channels for the institution. And if I didn't happen to work here, I might not have this position within the academy, because I know that there are other institutions where they actually discourage or prevent their clinicians from participating in social media. So yeah, the variability is tremendous and can have a profound impact all the way down to the individual provider in many situations.
Yeah, that's great. And I think that speaks to, and that's certainly the credit to your institution, that because of their willingness to allow you to flourish in your talents, and that you've added tremendous value to the specialty by being able to move into that space, and also show how it can be done well. And I think that's what we need for AI. I think we need to be able to show people that it can be valuable, that it can improve outcomes, that it can maybe alleviate safety concerns. And who knows? Wouldn't it be amazing if it did all that and also helped us reduce costs?
Yeah, absolutely. When I'm having a rough day, I'm going to think when Nick Ryder told me that I flourished in my talents. That's very, very kind of you. Thank you.
You could probably ask 100 of our colleagues, and they would tell you the same thing. You're
Oh,
well loved,
stop. I'm not fishing. I'm not fishing. All right.
Abe.
Uh, Thank you, Nick. All right, next question. What are the ethical considerations and potential risks of using artificial intelligence in sensitive healthcare contexts?
Yeah, and I think this gets a little bit to the last comment. Some of the big risks are certainly around bias and fairness, which we touched on, and that is, you know, is the model going to perform well for everyone with whom it's analyzing
Mhm.
on? I think privacy and security is huge. I mean, we're obviously very focused on preserving the privacy and securing healthcare data for our patients, and so AI can expose organizations to risk because they are diving deeply into that data that they may not have before. And so now, wrangling that data, moving it from one environment to another, even within their own, firewall and secure environment, you still, have to be cognizant of privacy and security. And the fact that some of these models, when they ingest information, it's not just a numeric weight necessarily that changes over time. You're actually it part of the electronic health record is contained within the model. So we have to be cautious about these kinds of things. And then I think risk. Like if a model tells me to do something and I disagree and a patient has a bad outcome, who's liable? Well, it's
Mhm.
me. It's not the model. It's me. So I think we need to understand risk, and there needs to be some good legislation around that. But I think these are all really important elements that get to some of the ethical aspects of AI, reducing disparities, not promoting disparities, making sure that we secure sensitive data and that it's not, you know, that AI isn't making that worse or making that more challenging. I don't believe that it has to, but these are things we have to be intentionally focused on.
This is a little awkward for me, but can I make a confession to you right now, Nick?
Yes.
All
I feel
right.
like I'm a
So
priest.
no, well, all right. Here's the deal. The 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 last five questions that you said were terrific and great were all generated by artificial intelligence. So I used a platform called Writer, Ryter. I asked Writer, what questions should I ask Dr. Nick Ryder about how artificial intelligence impacts healthcare? And those are the five questions it gave me. So what are your thoughts on that?
Well, first, that is not my platform, even despite the similarity between my name and
Ah,
its name. Um, I was going to tell you that I was just taking all the questions that you gave me and then running them through ChatGPT, but that's not true. That's not true.
that'd
It's
be,
not
it'd be
true.
amazing if we did that for this whole interview.
Dueling GPTs back and forth. Like Dave and I are just bystanders, like listening to these GPTs have a conversation.
Oh my gosh.
No, that's the cool thing, though. Really, I mean, I think for all of the concerns out there, these tools are really powerful. And just like any tool, sure, there can be some negative side effects that we have to mitigate against. But I think it's pretty awesome that you can come up with a list of useful questions, valid questions, helpful, insightful questions, and at least kind of kickstart that with this platform.
Well, now that I've broken your trust, I promise you the rest of this is just my questions. They won't be nearly as good, but
They'll be better. They'll be better.
yeah.
No, they'll be
Okay.
good.
My first real question: what is AI? No, I'm just kidding. Okay, so can
This is
so
an
can you
autonomous voice that I was hearing. It wasn't even Dave Stukus to this point. Okay, Dave, welcome. Welcome to the conversation.
can you give us some examples about how you, Dr. Nick Ryder, currently use AI in your personal and professional life? So, what do you're the top of the food chain when it comes to this stuff. How are you utilizing this right now?
I mean, like everyone, I use ChatGPT. I do. I mean, it used to be that if I was writing code, whether it was for something personal or for my research, that and I was stumped, I would go to Google and I would say, Google, how do I do this? And then I would like get directed to Stack Overflow or Stack Abuse or one of these other sites where someone else had solved this problem. Now, first and foremost, I go to ChatGPT. So I use ChatGPT regularly for both personal and professional um, questions where I either want to just find an answer to something quickly, or I'm trying to prime my own thinking and spark some additional downstream thought. So I use that all the time. And then I think that's more of like the active engagement with an AI that you're actually seeking out using an AI. But then I think, like as I mentioned before, I mean, Google Maps, I feel like I'm addicted to using that. Like even if I know where I'm going, I just want to
Mhm.
know, is there going to be any delay down the line? Like because you could say this usually takes me a half an hour, but why is it saying 45 minutes? Okay, so I mean I use that all the time. I use Google tools all the time for just routine life like wayfinding and so forth, as I'm sure many of us do. And then professionally, I mean we're developing in the lab and we're coding in the lab all the time, all day, every day. So, using AI for that, whether it's directly building AI systems or using AI systems and testing open source like large language models, that's something that we're actively engaged in.
I recently learned about AI internet search engines, which are very different than Google and Yahoo and things like that. So, as our listeners are hopefully well aware, Google, you and I could put in the same question. We're going to get very different results because you get paid ads that show up at the top, and our prior clicks and searches will change the algorithm and things like that. But when you use AI, it kind of gives you the purest form of the search in some ways. Are you using any of those at this point?
I'm seeing that show up in Google because there is an LLM response that's coming through now as of maybe the past few months. So I guess I'm not really changing my practice in terms of which search engines I've used, but I'm seeing more native AI, LLM driven functionality come back
Yeah, it'll be interesting to see all this evolve in the coming months to years. Well, tell us
for
more about
sure, for sure.
how AI is already being utilized within the electronic health record system. So what tools are out there right now?
Yeah, I think a couple of the big ones, first and foremost is this concept of ambient listening.
Hmm.
Are you familiar with that? Have you seen that before?
I have not seen it. I've heard of it, but if you can give us a
Yeah,
description of that,
sure.
yeah.
Yeah, happy to. So in this case, the AI is a voice AI, and the ambient listening is this large language model that's actually listening to an encounter between a clinician and a patient. And it can record, and then as a chatbot will, you can then tell the AI or this ambient listening device to create a soap note in an eighth grade at an eighth grade reading level, or whatever you choose, and maybe even in a different language. So, and this ambient listening technology is certainly under the hood of that is large language model functionality, and that is something that is being now piloted and used in major electronic health record company functionality. So, and we're piloting its use at Carillion Clinic. I know many other institutions are using it or piloting it or using it to improve clinical documentation in terms of the burden of clinical documentation. That's really the goal is, hey, can we be typing less? If this ambient listening AI can ingest the dialogue between a clinician and patient and then produce effective documentation. And then I think that's a pretty good example as well of augmented intelligence where you're going to overcheck that node and make sure that the essence of that node is accurate. You're happy with it. So I think that's one area that really has been on the forefront. One functionality that's been on the forefront that's using AI. The other one that I think is going to be really exciting is this notion of inbox management, where
Mm.
AIs, again, large language models, can interact with patients and maybe reduce the number of times that a clinician has to type in a response, and also may reduce the time response time to a patient. So I think this is also something that is being worked out. It's certainly not optimized yet, and I think this will probably reduce documentation burden as well. But these are a couple big examples. And then, of course, machine learning models can be embedded within these parts of the electronic health record called the inference engine, where you can build a machine learning model to predict everything from fall risk to readmission rates to
Mm-hmm.
maybe even drug-drug interactions, and that type of AI has been around even longer than the first two, the ambient listening and the inbox management. So these are some of the ways that AI is already really making its way into mainstream practice.
Yeah, it's so fascinating. It seems like it happened overnight in some instances as well.
It really did. I mean, really, we're talking about less than 2 years.
Oof. So could something like this help with, these time-consuming tasks like prior authorizations or even all those school and daycare forms that we have to fill out every year?
Absolutely, absolutely. I mean, just like we may ask, just like you asked the platform what questions to ask me. I think we can ask an LLM to produce a school note, or to produce or to fill out a prior auth, and understanding the structure of that prior auth. An LLM could produce it, and then we just overcheck it and send it in.
Hmm. Oh boy. It seems kind of obvious that anything that saves us time from these mind-numbing tasks that we do during our workday, that we know lead to decreased, job satisfaction. That hopefully, if we can save time with that, that it would improve our well-being and job satisfaction. But do we actually have evidence yet that this is the case with AI integrated into our EHRs or along the, in healthcare in general?
Yeah, there actually has been some nice literature out there that has shown, in particular with the ambient listening, there was really actually a nice New England Journal of Medicine article that came out earlier this year, looking at this ambient listening functionality, essentially using the AI as a medical scribe. Yeah, as I talked about a little bit before. And you know, at least the signals that they measured in terms of like time in clinical review by appointment, time in basket, time in orders, time in notes by appointment. There was a pretty significant improvement in the time of note by appointment. So even though, and so I think some of the general secondary aims of that article suggested that clinicians were pretty happy with the technology. Like it didn't move the needle on everything that they thought was important, but it
Mhm.
definitely improved their time and documentation. So I think your question is a really good one, and there is some nice evidence to suggest that our quality of life can be improved through this technology, but I don't think we fully realize yet maybe how good it could be, or what are some of the balancing measures, and does something get better and then something else gets worse? Don't know.
Right. Well, I mean, the first thing I was thinking about the ambient listening is, oh, that's great if I don't have to type out the note, but if I have to spend more time editing all the notes, then it's going to make my life a living hell, and I don't want that.
Right. Yeah. Yeah, it seemed like, at least in this one study, and certainly more literature to look at, that it was either neutral or better than
Mhm.
prior. It didn't seem like, at least across the metrics that they looked at, they didn't see that the technology made the clinician's life worse. But I think your point is really well taken, and that especially in a single study or a series of studies, which are published and have to be really well circumscribed, you may not be able to capture that negative impact. So I think this is very important, and we need to look at this holistically. And we also need to kind of draw the distinction between efficiency, and that is just kind of getting more done
Mhm.
per unit time, and productivity, and that is actually outcome focused. Like, does it actually improve outcomes? Or is it just allowing us to get more done per unit time?
Mhm. We've seen tons of stories in recent years about how students at various levels are using AI for writing reports or completing school assignments, and now medical journals are establishing guidelines for ways in which AI can and cannot be used for research and writing manuscripts and things like that. Yeah, is the cat already too far out of the bag? Is this just the way the world functions now? And how's it going to change moving forward?
Yeah, I mean, I think the cat is out of the bag. I mean, I think we can't expect that people are not going to use large language models, and I'm sure you're seeing. I know I'm seeing it. We're both seeing it. Anytime we submit to a journal, or review for a journal, there's a disclaimer that we need to address regarding use or lack thereof of large language models. So I think what's good about that is no one's sticking their head in the sand and saying people are not using this. We're all assuming
Mm,
people are using these technologies, and then just
hmm
the question is, how do we use them appropriately? I mean, are we using them to, again, augment maybe our writing, and then we take what we like, and just like we would remembering something we'd written in the past, or that someone else had written in the past, and how they phrased that, and that might shape how we phrase it today for this particular writing, and augmenting that process, which could be very constructive to the downside of it, and that is plagiarism.
hmm
And if large language models are trained on the entire internet, and someone's writing a paper on something, well, and they ask ChatGPT to write this paper for them, well, then it's going to be plagiarism, because the GPT is going to be probabilistically filling in sentences based on what it's read before, which is going to be the words and thoughts of other people, and that certainly is dishonest. So I think understanding that it's being used, setting up appropriate guardrails that allow for this tool to be used constructively is going to be it's already happening, and I'm glad it's happening, and it's going to continue for sure.
hmm You touched upon this earlier, but right now, how can we help allergists and immunologists, or other healthcare professionals at different stages in their career, better understand and utilize artificial intelligence? Are there tools from the academy? Are there sessions at the annual meeting, workshops, practice management workshop? Tell us about different ways that we can all learn more.
Yeah, absolutely. So for sure, I'll put a plug in for the HEIT committee, or the Health Informatics Technology and Education Committee within the Quad AI. This is a group of great people that are really intensely focused on everything from telehealth to AI and machine learning to DEI, et cetera. And so I think joining one of these work groups within the HEIT committee would be great. Certainly, I'm excited about the upcoming practice management symposium coming up here just in a couple weeks in Denver, where we'll actually have a session on technology, using technology marketing within your practice, and how AI is going to currently and will impact allergy immunology. So I think, some of the content that's been offered at recent academy meetings, and again, the work groups and committees as mentioned, and then some of these other sessions within, say, the practice management workshop are all going to be opportunities for allergist immunologists to upskill, to learn more, to dialogue, to share their experiences so we can all learn together.
That's great. If I asked you to peer into your crystal ball and predict how AI will be influencing the practicing allergist in the year, say, 2030, what will this realistically look like, what, 6, 7 years from now?
I know it's kind of crazy to think that we're not even 2 years out from ChatGPT being released,
Yeah.
and we're already talking about ambient listening, right? So even though I think that say to myself, "Wow, 2030, that's not that far away." Well, it's
Mm,
you know, two times the roughly 2.5 times the time distance between now and then compared to when ChatGPT was released. So a lot can change. I guess I think pervasively healthcare is going to be dramatically affected, and that we're going to get closer to seeing AI will be mainstream by then for sure within electronic health records and within the practice of medicine. I think we're going to see us move closer to actual true personalized medicine. And what I mean by that is, right now when we sit down and see a patient and we are flipping through the seemingly innumerable tabs in an EHR user interface, I think AI will drastically alter that for the positive, so that information about a specific patient, past drug interactions, maybe even pulling information from outside knowledge repositories to see how this patient generalizes to another cohort of patients that maybe wasn't even published, and what therapies might be most optimal for them, or lack thereof, therapies that may be more harmful for them. So I think what we're going to see is a move much more towards personalized medicine, because we're able to synthesize and sift through a large corpus of information, really while we're taking care of patients on the fly.
I like that, and I agree with you. There's an interesting, if you look at the world of chess, like grandmasters and things like that. The first computer that beat the world's best chess player wasn't that long ago. And then when they actually combined the computer with the grandmasters, they actually outperformed, because now you have somebody with the skills and the intuition that actually has the entire world's database at their fingertips, and you can just learn even faster that way. So kind of combining the two, it sounds like a very promising future for all of us.
And just look how easy it is. How easy is it to spend money on Amazon, right? And part of that is just because they recommend product stuff that are so similar to other things we purchased or that we purchased in the past. So
Mm,
these types of recommender systems, which are AI functionality, AI under the hood of that, is another area that electronic health record companies are looking at to improve, finding information on patients. I mean, beyond just like a string search or a chart search for a certain word, where the offerings maybe that, like the labs that you typically would order, or the way you work through your own personal interface within your electronic health record portal is presented to you in that way, and that the system learns how you operate and then facilitates your interactions by understanding how you previously interacted with it. I
mm-hmm.
think this is another aspect that we'll see functionality improve.
Fascinating. You clearly have a passion for this topic, and your new position, I have no doubt, is going to afford you some tremendous opportunities. Are you able to offer some insight as to what you're working on at this time? And it's okay if you can't. I completely understand that.
Oh, no, no, sure. Thanks for the question. I appreciate it. So a couple things. I have a long-standing collaboration with the Jeffrey Modell Foundation, and we've advanced the tool that they had developed over a decade ago now. So they were certainly way ahead of the curve in thinking about AI for diagnosis of patients with primary immune disorders. And that tool is called the Spirit Analyzer, and we're working on upgrading that and building some advanced AI machine learning into that. One of our kind of really intense foci right now is how do we enable, you know, health systems to operationalize AI for patient finding in this space, patients with primary immune disorders. So that's an area, development and enhancement around the Spirit Analyzer. The other item that we're really excited about is our Project Echo platform called PEPI, which is Project Echo for Primary Immune Disorders. And that, are you familiar with the Project Echo? With that
No,
that
please
that
offer some
that
background.
Yeah,
Yeah.
yeah, sure. So Project Echo was born out of the University of New Mexico by a gastroenterologist named Sanjeev Arora. And Dr. Arora noticed that he had patients coming with hepatitis C and advanced disease from rural parts of New Mexico, and that if they'd been able to have access and be seen earlier, that they would have been, able to be cured or treated much more effectively. But they came with advanced disease just because they didn't have access. So this was, a decade or more ago, before, the advent of using Zoom and Teams and virtual platforms. So he essentially created a virtual platform, and his platform was called Echo, which is the extension of community health outcomes in the University of New Mexico. And that first use case was really focused on patients with hepatitis C. He created this virtual platform, published his outcomes in the New England Journal of Medicine, and really through this intervention, by just being able to interact with primary care providers that were at a distance from his center, at the academic center, and interacting with patients by extension. Kind of their motto would be moving knowledge, not people, that they were able to move knowledge into these small communities throughout New Mexico to impact care, and showed a measurable improvement in these patients' outcomes. And since that time, Project Echo has grown into several hundred distinct projects that are typically disease focused, but not necessarily, across the country and across the world. And so we launched the first Project Echo focused on patients with primary immune disorders that has had continuous educational content. And the two arms of that are, number one, providing educational content to healthcare providers and primary care clinicians across rural America, although we're happy to have anyone access our platform. And we provide bite-sized nuggets of information about diagnosis of primary immune disorders, what the initial laboratory evaluation might look like, and so forth and so on. And that's a collaboration with colleagues, Monica Lawrence and Larry Borish, who are at the University of Virginia, myself, and then Angie Tyree, who's a nurse in Lynchburg. And that's the one arm. The other arm of it is we provide free case consultation through the portal, and that's not open to everyone. That's open to individuals. Those are closed sessions. It's open to everyone, but the sessions are closed, so that if a primary care provider from rural West Virginia wanted to reach out to us and run a case past us with confidentiality, we'll help advise that primary care provider about the evaluation of the patient, and just have a dialogue with them about working up that patient. So, this PEPI is really a virtual learning health system for patients with primary immune disorders, and that's something I'm super excited about. And then we have a number of initiatives around using large language models and building machine learning models to understand distinct primary immune disorders at a deeper level.
Oh, wow. Thanks for sharing. That sounds amazing across the board. And again, your passion for this just really comes through the more we hear you talk about it. It's so cool to hear. I love the
Thanks.
concept of moonshot thinking, which, for those who aren't familiar, you basically take a huge, seemingly insurmountable problem, and then you propose a radical solution to that problem using disruptive technology. You used that word disruptive earlier. What do you think is the moonshot goal when it comes to how AI can improve healthcare?
Yeah, I love that. I mean, we talk a lot about this quadruple aim, right? Lower cost, better value, um, improving patient experience and provider satisfaction, healthcare clinician satisfaction, and then of course health outcomes. But in the U.S., right, our almost 20% of our GDP is spent on healthcare, and then of course our outcomes, when you look across the developed world, are middle of the pack. So
Mhm.
I think the moonshot goal should really be, how can AI get us closer to this quadruple or quintuple aim? And while I'm very excited about the technology, I'm actually much more excited about health system optimization and the ways that which in which AI can improve health system process, providing better care, more affordable care, safer care at the individual and the population level, and in a way that actually makes clinicians' lives better too. So I think that because you ask about a moonshot goal, I think I can talk in that kind of hyperbole. I think you've given me
Yeah.
the leeway to do that, but I think that
Absolutely.
that should be the goal. That I mean, as excited as I am about the technology, and on the research side of things, we can pursue a lot of very interesting technical hypotheses, and the science around that is very interesting to me. But at the end of the day, yeah, I really want to see this technology make a difference for patients, patient outcome, patient safety, quality of care, and clinician health and well-being. So I think that's the moonshot goal in my mind.
Okay. Well, we'll have you back. I don't know if and when we achieve that, or the next big thing comes along, I guess.
Let's do it.
Well, you've been very generous with your time. I could chat with you about this for hours. We really appreciate you coming back. Would it be okay if I ask some more rapid fire questions as we wrap up our conversation today?
Absolutely.
All right. First question. What is your favorite science fiction movie and why?
That's a good one. It is a good question. So I'm going to deviate from the expected answers like
Ooh.
Star Wars and The Matrix. I've really gotten into the Dune movies, the more recent
Mm-hmm.
ones, and that
Mm-hmm.
that made me I liked both of them, Dune and Dune Part Two, a lot, and helped me kind of think a little bit more about Frank Herbert and his influence on science fiction. And this has been a dialogue between my 18-year-old son and I because he, unlike his dad, who saw the two movies and was like, "That's cool, back to normal life," working and so forth. He's actually read the whole, all of Herbert's works, and so he's kind of
Mm-hmm.
turned me on to like how impactful Frank Herbert was in advancing science fiction and thinking more about where society will be in the future and less
Mm-hmm.
about maybe technology, which is kind of interesting in a podcast about AI that that I'm influenced more heavily by someone who might be focused more on how humans will evolve over time than the technology. So I really like Dune for that reason.
Okay. Have you read the book?
I have not read the book. My son has, but
Uh,
I am guilty of not having read the book. Have you?
I have. So I love the book. I've read it twice. It is so well written and it takes such a deep dive into all these complex issues. I started the movie. I couldn't finish it because I think the book is that much
Ah,
better. I may be an outlier here, but if you
you
work it in,
know,
let me know what you think.
yeah. You've inspired me. Between you and my son, it's on my list now.
Okay. It's our 14-year-old son couldn't read it. It's pretty dense. And he was like, "This is
Yeah,
not what I want right now." But I loved it.
yeah, yeah, yeah. It is a tome. It's big, right? I mean, it's
Yeah,
it's
yeah.
thick, but yeah. I mean, from a movie standpoint, I really love those. And I don't read a lot of fiction. But yeah, you've inspired me. Between you and him, between you and my son Zachary, you twist my arm on. I'm going to read
All right, Zachary, let's make Nick read this. um,
it.
all right, you mentioned this. I was going to ask anyway. So, The Matrix, the movie, it's like 25 years old, and I've watched it recently, and it seems more like a documentary than ever before, except for the aliens. But we don't know. I mean, they may be out there. Who knows? So, how close are we? Like,
Yeah,
Meta wants us living in this augmented reality at all times. The entire goal of all these
right.
social media algorithms is to keep us plugged in. Is that our future or present?
I think it's not. I do agree with you. I think there's these pockets of the matrix where it's created the environment and we're feeding it in ways that we maybe are conscious or not conscious of, and that's allowing it to thrive, like was in the case with the matrix. And I think you're right on. Social media is kind of one of these pockets that we're all interacting with on a regular basis, right? Where it's the social media platforms world, and we're all just kind of living in it and feeding it. But yeah, I mean, I think again we will see greater and more pervasive use of AI throughout technology, but Yeah, I'm still a believer in the human spirit. We'll
Mm,
overcome and we'll be able to adapt and constrain and harness this technology. But I think philosophically, it's a super interesting question, and I think you can certainly see where the similarities are between current day and the Matrix.
hmm. Well, what's the scariest part about AI for you?
Um, I'm more of a risk taker, so I'm not super worried about like where AI is going and its penetration to society. So I'll couch my response with that preface. But I think the scariest part to me is um, maybe it not being utilized to its potential.
Mm,
I think there's so much opportunity for this technology to do good, to extend us, to augment us. And I think if it's not maybe broadly utilized in appropriate ways and constrained maybe because of fear, or we're not thinking about the right things, then I think that's the scariest part is underutilizing and having less impact than it could. And I think that gets to having very diverse representation and thinking about development of the models, deploying the models, and sustaining the models. Because I don't think any one entity, one title, one perspective is enough. I think that's where, as a society, we really need to make sure this technology benefits every member of society in, of course, positive ways.
So, flip side, what's the most exciting part about AI for you?
I think if we can get that right, honestly, I think if we can get
Mm,
that right, then we can see this technology transform and solve problems that were seemed insurmountable from a computational perspective, and whether that's designing new therapies that now more safely and effectively cure horrible diseases like Alzheimer's or certain, really any cancer, you name it. I think that's exciting. I think the ways that it could transform and bridge the gap between where we are today and some of these things that we're really trying to, some really tough nuts to crack. I think this technology can help us get there.
one final question, and I'll remind you this is being recorded. It's going to be listened to by millions upon millions of listeners.
No pressure.
Yeah. All right. Are you actually a cyborg sent from the future to save us from the apocalypse?
Well, I don't believe that I am. I don't believe that I'm a cyborg, and my evidence for that would be there's a lot of evidence. I think I'd be a better athlete if I was a cyborg. I think my 40 time would be better. I think maybe I'd be like a little faster on the bike. So I think I'm just a fallible human. Sorry.
I think that's exactly what a cyborg would say, to be honest with you. That's like the, I don't believe that I am. What?
Well, I could produce a birth certificate, but that might not prove anything to you either. I don't know, because maybe that was just
No.
generated by ChatGPT, and I say, ChatGPT, produce a birth certificate for this fictitious person named Nick Ryder,
Oh
and make it
my.
look like it's several decades old.
See, you have it figured out. Like, oh, all right. Well, Nick, whether you're a cyborg or a fellow human being, we can't thank you enough for taking the time to join us. We really appreciate it. You're an expert amongst experts when it comes to this, and we're glad to have you in our specialty leading the way. Is there anything else you'd like to add before we depart?
Hey, thanks so much for having me, Dave. It's really a pleasure. It's always fun talking to you. I really enjoyed this conversation, and I hope you'll give me a third crack at this as well.
Yeah, it'd be our pleasure. Thank you again. We hope you enjoyed listening to today's episode. Please visit www.aaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Amazon, iHeartRadio, or Spotify so you can receive new episodes in the future. Thank you again for listening.